of people who are here?
I don't suppose there's not so much of a message. We absolutely want to hear the perspective of everyone. So we're just literally having conversations with people in the crowd to talk about perspective, why they believe that this is something that's good for Ohio. Obviously, the people that I work with, we don't think that this is something that's good for Ohio. So it's a matter of understanding perspective on things, that's all.
Some of the business leaders out there are saying that they support this, that their businesses support this, because it would actually make it easier for them to afford to buy the health care.
Well, so this is real interesting. There's 5 states that we've seen very recently expand Medicaid. Arizona, Delaware, Oregon, Maine are just some of them. And what we saw happen in those states is that lots of employers started dropping coverage when Medicaid expanded. So we saw a shift from private insurance, so where people were paying for it privately, obviously, and then when they were eligible for government subsidized insurance like Medicaid or some kind of exchange or whatever was being discussed, all we saw was people move from one place to another, but the total number of uninsured people in the states, and the studies are out there, right from the Arizona legislature in particular is where I pulled this information, it didn't change. And in some instances, actually, the number of uninsured went up. And what we're also seeing is premiums are going up. So it's a lose-lose situation for the employer. So I can't even get into the reasons why they would want to justify it. Obviously, you can speak to them about that. But what we know from empirical data, that's just the last 5 states to expand Medicaid, is it was about 4 times over the cost they projected. Again, I'm citing Arizona here. The number of uninsured people went up. I'm also citing Arizona on that one. And all we really saw was a shift of people that were in private insurance over to publicly subsidized insurance. So one of the reasons why the tax costs went up. So this, for me, is very much about expenditure, and then also Medicaid doesn't have the greatest health outcomes in the world, so I don't know why we want to put more people on that system rather than in the private insurance system, because it costs taxpayers more and it's worse health outcomes.
But doesn't that make Ohio at a competitive disadvantage with Arizona and other states if businesses can move in there, shed the private insurance mandate, and be able to do, have a lower cost of doing business?
Well, if you look at one of the number 1 reasons why top few reasons why states or businesses relocate or expand in certain states, we have basically regulatory environment, tax environment, and labor environment. Not shocking to anybody there. Ohio's behind in all of those. We have a serious jobs problem in the state, long-term job creation problem. But another one that companies consider is long-term stability for spending. So for instance, Forbes, not me, Forbes called Ohio one of 10 death spiral states because our long-term liabilities were so long. So if you're one of those businesses, what is your incentive to move into this state when we're going, my goodness, we're going to embrace one of the largest, the number 1 budget item that is in the state of Ohio right now, and also one of the fastest collapsing items at the federal level. That is not something that says to any employer, boy, I really want to invest into this state that is costing itself some of the largest long-term liabilities that the federal government already has, and they're taking on more at the state level. I don't think that's going to encourage business to do anything.
Well, once again, why are you against this? Why are the people you represent against this idea?
Well, I said it before. You've got 3 reasons that are really big. One, this has done nothing to help with regards to access to care. We're seeing the numbers play out in those states that the number of uninsured is not improving. So access to care is not there, and premiums are going up. That's the whole country watching premiums go up. That's not helping access to care, so that's off the table. Long-term expenditure is a huge thing. It is already the least sustainable thing in the Ohio budget, and certainly at the federal level. They have no money. There is not. I cannot say this strongly enough. There is not a set pot of money for Ohio at the federal level. It doesn't exist. They're only going to be able to give money by further indebting our kids. My kids. I have 3 kids. They're 8, 5, and 2. Little kids. And they're going to have to live with an even larger debt burden. Billions, hundreds of billions of dollars more money over a course period of time. And then it's also into a system that doesn't have the greatest outcomes in the world for the patients themselves. I know this because I worked with the Medicaid population for years. I was in the home health care industry, and I did sales and business development and worked with families and doctors and insurance companies and everything else. I can tell you firsthand, that's not a situation we want people in long term. And if we're facilitating more people getting in that situation that's actually really bad for their families and their future, how can you support something like that? I think it's a horrible system.
How do you answer the argument that there's broad-based support and all these people, can't have it.
Sure. Well, I'd say with regards to sort of government intervention in people's lives and the government takeover of healthcare, which is what we consider this, is this more people on government healthcare, more money government in the healthcare system. They had a vote on that in 2011, and 66% of Ohioans said we don't want more government in our healthcare, and we don't want to see more intervention. They had that moment. All 88 counties, every single one, voted yes for the Healthcare Freedom Amendment in Ohio, and that was the largest victory for any citizens initiative in Ohio history. So to that, it is a very wide coalition of people. I mean, Ohio spoke on this in 2011, and so I feel very confident in this position.